Hi, I'm Dr. Thompson. Before we begin, can I confirm your name and date of birth, please?
Sure, I'm Jane Doe, born on 2001.
Thank you, Jane. I'm here to talk about your recent HIV diagnosis and to discuss your plans to start a family with your partner. Is that all right with you?
Yes, that's right. My partner and I have been planning to try for a baby.
Great. Do I have your consent to proceed with our discussion today?
Yes, I do.
To start, could you catch me up on what's been happening recently?
Well, my partner and I decided to have some blood tests as we were planning to conceive. I was really shocked when my results showed that I'm HIV positive. When my partner asked about it, I panicked and told him everything was normal because I didn't know how to handle the situation.
I understand this must be overwhelming. Have you had a chance to inform your partner about your diagnosis?
No, I haven't told him yet. Things have been good between us recently, and I'm really scared that if I tell him, he might leave me.
And just to clarify, since you started dating, have you had any other sexual contacts?
No, it's just been him and me for the past 3 years.
I see. You mentioned that you've always used barrier protection, but you're planning to stop using condoms soon to try for a baby. Is that correct?
Yes, that's right.
Thank you for sharing that. Could you help me understand a bit more about why you feel unable to tell your partner about your HIV diagnosis?
I'm terrified that if I tell him, he'll leave me. He's been the kindest person in my life, and I'm just so afraid that this will be the last straw for us.
It sounds like you care about your relationship deeply, and it's completely natural to feel scared about such a difficult conversation. I'd like us to discuss your diagnosis and explore how you might approach talking to him, because it's important for both of your health. Does that sound okay?
Yes, I really need help figuring out what to do.
Before we go any further, would you feel more comfortable having someone else in the room, like a counselor, or would you prefer to continue our discussion one-on-one?
I'd prefer to talk just with you for now.
All right. I want to explain why it's so important to share your HIV status with your partner. When you both have unprotected sex, there's a risk he could contract HIV without knowing it. If he remains unaware, he might not get the timely testing or treatment he needs. I'm really sorry that you're in this situation.
I know it's the right thing to do, and I feel awful for not telling him yet, but I'm just so scared of how he'll react.
Your feelings are completely valid. As a healthcare professional, I have a duty of care to both you and anyone else who might be affected. If you're unable to inform him yourself, I have an obligation under professional guidelines to ensure he's made aware of the potential risk to protect his health.
I hadn't realised it was that serious. I really don't want him to get hurt.
There are options available to help you manage this conversation. For example, we could involve a counselor or another healthcare professional who specializes in sexual health. We might even arrange a meeting with both of you or have the sexual health clinic send an anonymous letter if you prefer.
That sounds like it might help me figure out how to handle things.
Additionally, if you start HIV treatment and maintain an undetectable viral load for at least 6 months, while also ensuring you're free of other infections, there are safe ways to conceive without putting your partner at risk.
That gives me some hope. It's reassuring to know there are options.
Before we finish, do you have any questions for me right now? Could you summarize the key points of our conversation to make sure we're on the same page?
Okay, so I understand that I need to tell my partner about my HIV diagnosis because not doing so could put him at risk when we have unprotected sex. I also know there are support options available, like counselling or even having a professional help communicate the diagnosis. And if I don't tell him, you might have to, because of your duty to protect his health. It's a lot to process, but I see why it's important.
Exactly, Jane. It's a difficult situation, but I'm here to support you every step of the way. We can work together to find the best approach for you both. Please feel free to ask if you have any more questions or need further clarification.
Thank you, Doctor. I really appreciate your help and understanding.